index, which means it converts to sugar really fast in your system, or we look at whole wheat bread. Which one has a higher glycemic index?
The white bread.
The white bread. The white bread. So if we're going to make choices like this, we want to try to make things with high glycemic index. So here's the general rule of thumb. The more fiber that you take in, the more likely the higher glycemic index is. And you'll see just this chart that we've given you. So no glycemic index or low glycemic index, cauliflower, green beans, squash, peppers, broccoli. Those are pretty fibered things, right? You got to chew them pretty hard, and they're a little bit more difficult to digest, okay? Lower glycemic index, a grapefruit. Again, a grapefruit has a fair amount of fiber in it, right? As you're eating it. Now, we're not talking grapefruit juice, okay? None of, God bless you.
Thank you.
None of these things are a fruit component, okay? We're only looking at the actual real live fruit itself, okay? So it's not something we're going to squeeze and put into a bottle. Oranges, peaches, lentils. Medium glycemic index, apple juice, buckwheat, navy beans, parboiled rice, those types of things. And then a high glycemic index, Life cereal, white rice, Cheerios, all of those types of things, which you may well have every single day. So when we look at a person that has a bagel in the morning, what do you think that bagel does to their potential testosterone levels?
Lowers it.
It lowers it. So on a daily basis, do you think there might be some things that you could change to increase your testosterone levels just with foods you take in? Yeah. Now, the general rule of thumb that I'll describe is a 75-25. So 75% of your meal plate is protein, and 25% would be carbohydrate, okay, or fruits and vegetables. Now, I would generally say to you, if you want to be really committed to this type of program, is I wouldn't take in any breads and pastas at all. None, okay? I would strictly take in fruits and vegetables on that side of the plate, and 25% protein. The protein would be the steak, the eggs, the bacon, your chicken, all of those types of things. And again, the size of your palm and the thickness of your palm. Now, here's one downside, because some men will say to me, well, I absolutely need more protein, because protein builds testosterone and builds muscle. And I get that, but at the same time, you know what it also does? Increases your acidity of your body, which causes more inflammation, which is going to pump down your testosterone levels. So really bear with this idea of 75-25. Now, if you're a high-level athlete, you might need a little bit more than 25% protein. But again, you kind of have to figure that stuff out, okay? You might be at 30%, you might be at 35%. You're definitely not at 50%. You don't need half your plate of a steak, okay? So 75-25 is a good overall approach to say, with this approach, we're getting fibered carbohydrates with the fruits and vegetables. We're having a decent amount of protein, which is going to slow down, further slow down the absorption of the carbohydrate in those fruits and vegetables. And we're going to have better balance of our testosterone levels. So now, if protein slows down the absorption of, sugars, bear with me on this for a second, okay? If you want to have a candy bar, you're going to splurge. It's Friday night, you're going to splurge. Should you have the Snickers bar or the Milky Way?
Snickers has got peanuts in it.
Awesome. Snickers has the peanuts in it. Now, is either bar really that awfully good for you? Probably not. No. Okay, but the reality is, if you're going to slow the absorption down of the sugar, we'd want to match it with protein. So if you want to splurge with a dessert, okay, we would recommend throwing some nuts in with that, okay, or some type of protein on top of it to slow the absorption down. Does that make sense? So there's your first component to control insulin levels. Because again, as we take in lots of sugars, what's insulin do? Insulin pumps up. What's testosterone do?
Down.
It's going down, okay? So control cortisol along with the inflammation. This inflammatory cascade is absolutely critical to control, because we're not just talking about testosterone here. We're talking about life and death issues with testosterone, okay, and the inflammatory cascade. So the 75-25, it makes a huge effect on inflammation as well. In terms of fruits and vegetables, do you think that they would be pro-inflammatory for the body or anti-inflammatory for the body? Just a wild guess. They would be pro-inflammatory or anti-inflammatory? Fruits and vegetables.
Anti.
Absolutely. if you allow me to use the word, would God ever put fruits and vegetables on a planet if it was inflammatory? No way, right? No way. So fruits and vegetables are very anti-inflammatory, okay? The less inflammation you have, the less cortisol you'll have, the more testosterone you'll have. So does it make sense that we also want to look at the whole host of anti-inflammatories, okay? So what are some other anti-inflammatories that you could do on a daily basis to decrease inflammation? What's your dentist talked about with flossing your teeth? What's it prevent?
Bacteria.
How? It doesn't really prevent bacteria.
Well, no, but it keeps them clean so they're healthy.
Yeah, it keeps them clean. So it basically decreases inflammation around the gums.
Right.
Right? So does that contribute, the inflammation here, does that contribute to inflammation of the body?
Definitely.
Yeah. It can, right? So flossing your teeth may be one way to decrease inflammatory load of the body, which will also potentially increase testosterone levels. So we look at that, okay? We want to make sure that with this control on insulin levels, we're inverse in the relationship to the testosterone. So the more insulin we have, the less testosterone, the low glycemic index foods are really that key. And that's what we went over with that sheet, okay? So control cortisol along with the inflammation. Cortisol will increase the aromatase enzyme. Aromatase basically is in your body to break down testosterone to this, what they call estradiol. We don't want estradiol, right? Does estradiol even sound manly? Sounds more like estrogen, doesn't it? Okay? What do we want? We want testosterone, okay? So we want to slow this enzyme down, not speed it up. Cortisol will increase that. So again, does decreasing the stress make sense that it may actually decrease that aromatase activity? It does. Now this is a really neat study by Amy Cuddy out of Harvard, okay? What do you think a way posturally we could increase testosterone would be? It's pretty cool. It's a really good study. It's cited numerous times. So what does an animal do in the wild, or a bird do in the wild, when it wants to let the female know, hey, I'm here for you?
They put on a show.
What kind of show? What might it do?
They flap their wings or something.
Gordon's got it, right? So we're like this here, right? You know, some type of broad position like this. Do you know if you do 2 minutes... Now again, we're all men here, so I'm going to talk about this, okay? Do you think that if you're having some trouble in the bedroom, okay, and I know that's not why everyone's here, so I don't want you guys to think that that's the perception I have, okay? But the reality is the fact that if you have a presentation to do, and I was actually doing a presentation in Dallas not too long ago, and quite frankly I was nervous because there's about 200 people in the room, okay? So I use this technique, okay? But one of the things, and I never told you guys this about this technique. But one of the things you can do, Amy Cuddy says, is go like this. For how long do you think? 2 minutes. 2 minutes. It actually substantially increases your testosterone levels by 25%.
What's that range around?
Is that pretty big?
Arms to the side.
Arms up to the sides.
Arms up and to the
Okay?
side.
So way up like this. Now, the Wonder Woman pose like this is another way to do it too.
Yeah.
If you were going to have a conversation, like, let's just say Guido and I were going to have a conversation. We have an argument over where your fence line is on your house, okay? And I come up to you like this. Listen, right? Am I in attack mode?
Sure.
Now, if I go like this, now my shoulders are kind of rolled in, right, when I do this. I was just wondering if we could, what type of attack mode am I in now? Not too much, right?
No.
I have no power. I have no power. But now if I'm like this, now I'd probably look pretty goofy like this, okay? But maybe like this, I may have my hands on my hips and say, listen, can we talk about the fence issue we've got? Now, I don't know if Guido has a fence issue at all, but I know he does a lot. I know he does a lot of work on his house, you know. But nonetheless, so that's just a postural position you can do to increase testosterone levels as well. So you know, if you've got a presentation to give, you could potentially do that. If you've got an argument that you want to make with a boss or a coworker or something of that nature, you want a little more oomph, okay? Guess what? You could do this type of postural position. Now, I don't know if I'd walk around the office like this, okay? Saying, okay, let me talk to the staff about not having raises, right? So those would be things you'd want to be looking at, okay? Sleep deprivation increases cortisol. Again, how many hours of sleep should we have every night?
6, 8.
Anywhere from 6 to 8, okay? Gordon's got the, what's that, 7? So 7.5 is really the ideal scenario. Everyone's a hair different, but 6 to 8 is a really good number. They actually show 6 hours. I've seen numerous studies that say 6 hours will actually decrease testosterone levels. So really that 7.5 to 8 range is really the ideal scenario. They found that within a week's time, you have significant reduction in testosterone by losing sleep, okay? Does it also make sense that you don't feel a whole lot like doing much of anything when you're sleep deprived? It really does, okay? It's the honey, I'm tired syndrome, right? How about exercise? Excess exercise increases cortisol. Hold on, did I do that right? Excess exercise. Would I say that? Excess exercise, is there such a thing?
Yeah.
Yeah, absolutely. And I treat a ton of really high-level athletes that do these hours and hours of exercise. It's horrible for them. Absolutely horrible for them. Now, do they look good? Sure they do. Okay? But they're shot. They're exhausted. They're burning the candle on both ends. So what is excess exercise? Especially when we look at testosterone. Because you'll hear me talk a hair differently when we're not talking about testosterone. What is excess exercise when we look at cortisol levels? How much time do you think it is?
Over 35 minutes a day.
Awesome. How'd you know that?
A lot of reading.
Yeah, that's awesome. So over 35 to 45 minutes a day, okay? Now generally what I'll say to people is if you're over 45 minutes, you're done, okay? 35 minutes I'll give people, okay? I'll say, you know what, you're okay in that range, but now you're getting there. Now what about the person that's running 2 hours a day? Horrible, horrible for you.
How about half hour in the morning, half hour in the nighttime?
That's different. That's okay. Because you're giving your body the ability to rejuvenate itself.
So you don't just do 1 hour like this.
Exactly, exactly. Because again, what excess exercise will do is increase cortisol levels, and cortisol levels are going to do what to testosterone?
All right.
Plummet them, okay? So now we're going to actually describe something a hair different though with testosterone, okay? Because we want to actually pump it up pretty quickly, all right? That's what this whole presentation's about, is increasing your testosterone and conquering it. So we'll go over that in the next slide, but we'll talk specifics about cortisol itself, or testosterone itself, and how to pump that up, okay? The anti-inflammatory diet, we've talked about that with control of insulin, with the control of cortisol. Does anyone have any questions about a 75-25? Because I have to tell you guys, you can't just do one of these things and expect big results. If you've got significant changes in testosterone levels and you want to see some positive changes, you know what? Let's go full tilt. Let's go all in, right? Put everything on the line. Say, you know what? I'll do the 75-25 for 6 weeks. I'll do the exercise approach for 6 weeks. I'll decrease stress management for 6 weeks. I'll be all in. I'll change the diet for 6 weeks. Make sense? All right. So no other questions on 75-25? Okay. All right. So HIIT. What is HIIT?
High intensity interval training.
Awesome. Here, take this thing I'm sitting down, right? So awesome. Good job. Okay. So high intensity interval training is something that is really kind of revolutionary in the last probably 7 to 10 years. Okay. But it's maximum rev of those testosterone production cells from the Leydig cells in the testes. So we want to rev up those Leydig cells via HIIT exercises. So is HIIT exercises an hour exercise routine? No way. Look at this. 10 to 15 to 20 minutes of high intensity interval training. That's HIIT exercises. 10 to 15 to 20 minutes is not being obese, not having depression, not having some of those other issues, and having better testosterone production and better times in the bedroom worth 15 to 20 minutes? Absolutely, right? And let's forget about testosterone, just realize you're just going to feel better, right? You're just going to look better and feel better. So here's the general routine with this thing. The warm-up exercise, 2 to 3 minutes, right? And that's just make sure you're not going to pull a hammy, right? And we joke about that, but the bottom line, you don't want to hurt yourself, so you're out for 6 weeks, okay? Then we'll look at, and why I gave 3 different ranges there, it really depends on the study you read on testosterone. Some